Hey guys, Dr. Nick Wilson here. How can you heal naturally from a damaged disc, whether that's in your neck or that is in your lower back? What can you do to heal or repair your discs? And the question is, can they actually be healed? And what's the best way to do that? So whether someone, maybe it's you or someone you know, has had a disc bulge or herniation, a lot of times you tend to freak out about this. And there is a level of maybe pain or sense of hopelessness that comes with this. And really the first thing that comes to people's minds is a lot of times drugs, injections, physical therapy, sometimes even surgery. And injections, they can numb the area, but it doesn't get to the cause of the problem. Physical therapy focuses on strengthening and stretching, which is one component, but ultimately it's not getting to the cause. And obviously surgery removes the disc, or it goes in there and fuses the bones together, not addressing the cause either. So all three of these routes might buy you time at best, but it's not healing the problem. So you have to understand the disc, after puberty loses its vascular supply, it begins to rely on movement to heal and repair. So think of a sponge that soaks up water and releases water. That's how a disc functions, and it needs constant replenishment of the required nutrition. And when a disc bulges or herniates, that sponge no longer compresses and releases the way that it used to. And unfortunately, the problem is usually one that has been developing for years, and the disc bulge or the herniation is just a sign of dysfunctional spinal biomechanics. So if you have a bad disc, whether in your neck or in your lower back, here are 4 things you need to do to naturally heal. Number 1 is you need motion. This is what brings new nutrition into the disc by unloading and loading the disc with wobble and traction. You give discs the nutrition needed to heal. So we give all of our patients spinal hygiene exercises on a wobble or stability ball, really to increase the motion in the spine, which helps with lubrication and disc health and really disc nutrition. Number 2 is correcting bad postural patterns. So correcting posture isn't just standing up straight. It's subconscious, it's controlled at the level of the cerebellum. So correcting posture must be subconscious. And what your spine looks like from the side is you should have these 3 curves from the side. That determines your posture. So look at these 3 curves. And these 3 curves are actually protective. And then when the spine is properly aligned, then your spine is 16 times stronger. When the proper curves are maintained, then you're not going to see disc bulges, you're not going to see disc herniations or degeneration. So 3 is general strengthening with movements that help to actually extend the spine. It's all about stabilizing the muscles that extend the spine. So things like deadlifts help correct posture, properly picking things up off the ground. It's going to really help with that. This strengthens the big movers and shakers in your legs and in your core. Extending the spine helps. Google deadlifts, you're going to be helped with that. Whereas flexion can actually aggravate, so things like sit-ups and things like that can actually aggravate. So you want to maybe do planks, that's going to help with core stability. And number 4 is making sure you have the correct chiropractic analysis via your x-rays, so you can really see how the spine is aligned, where the spinal bones are moving or not moving, if they're locked up. That's going to really determine if the spine shifts out of its normal position. It's going to cause uneven stress and pressure to build up, and inevitably, if the disc is not biomechanically strong because of the alignment, it's going to be more susceptible to injury and disease and disc disease. And that's why if you have a disc problem, you need corrective chiropractic x-rays to identify the exact type of adjustment or adjustments that you're going to be needed to have to really help you achieve motion in the joint, stop or slow down the degenerative process, and really get healthy again. And really that's it for today. When it comes to your spinal health, this is Dr. Nick Wilson. Make it a great rest of your day.